A 44-year-old Caucasian male with a past medical history of intravenous drug abuse and obesity is diagnosed with an RNA flavivirus. A biopsy of the affected organ reveals lymphoid aggregates with focal areas of macrovesicular steatosis consistent with liver involvement. The patient is diagnosed and treated accordingly. But which of the following other manifestations of this disease might the patient experience? Whenever you see IV drug abuse, your first thought might be Staphylococcus aureus infections. But in this case, with liver involvement mentioned, we need to think about hepatitis, specifically hepatitis B or C. In the question, they have also pointed out that the patient has an RNA flavivirus. So let's decode this. How many types of hepatitis exist? We have A, B, C, D, and E. Now, if you struggle to remember which virus family each belongs to, here's a trick. Private hospitals favor rich clients to help you recall PHFRC. Hepatitis A belongs to the piconovirus family, B is from the hepadnavirus family, C belongs to the flavivirus family, D is classified as RNA delta agent, and E comes from the calicivirus family. Since the question specifically mentions RNA flavivirus, we know our patient has hepatitis C. Now, what are they asking? They want to know what other manifestations this patient might experience due to hepatitis C. Let's look at our options. We can eliminate option E because nasopharyngeal carcinoma is associated with the Epstein-Barr virus, EBV, which is a double-stranded DNA virus, not related to hepatitis C. It also shows atypical lymphocytes called Downy bodies. Option D, polyarteritis nodosa, while potentially linked to both hepatitis B and C, is far more commonly associated with hepatitis B. So we can rule this out as well. Option C, anogenital squamous cell carcinoma, is related to HPV, which is a DNA virus and has no direct connection to hepatitis C, so we can strike this out too. Plus option B, temporal giant cell arteritis, typically occurs in older patients and presents with polymyalgia rheumatica symptoms like muscle pain and stiffness, but it's unrelated to hepatitis C. This leaves us with option A, leukocytoclastic vasculitis, which is the correct answer. This condition, characterized by inflammation of small blood vessels, is a known extrahepatic manifestation of hepatitis C, often presenting with palpable purpura. Remember, when you see hepatitis C in a clinical question, always think about its liver-related complications as well as its potential systemic effects like vasculitis, cryoglobulinemia, and more. Follow us to learn how to decode tricky exam questions and stay ahead of the crowd by attending our free lecture. Thank you for watching.